This morning we have a veteran community moment speaker, and the amazing Mandy McKinney. When I asked for 3 words, she was like, go ask someone else. And so Melissa gave me 3 words to describe Mandy, so don't shoot the messenger. All right. No, they were all wonderful. She said that Mandy is compassionate, that she is adorable, and that she is a firecracker. And her husband, Jordan, who we just heard from, had her warning label, if she had one, it would be invite a nurse to dinner at your own peril. So we invite to the front our veteran community moment speaker, Mandy McKinney.
Thank you. All right, so if you didn't gather, I am a nurse. I recently, last November, changed positions from direct client care and wanted to talk a little bit about what I get to do now because I think it's pretty cool. I know health insurance is kind of one of those blah topics, especially Medicaid. The state and the federal government and individuals make a lot of mistakes with it, but I'm going to talk about something that's actually going right with it right here in the state of Missouri. All right, so I work for Comprehensive Mental Health Services. It's a moderately sized community mental health facility, and it offers all of these services: outpatient therapy, case management, psychiatric services, addiction recovery, and so on. The last one on there is Healthcare Home, and that's my baby, and that's what I'm here to talk to you about. I think it's really cool and very important. So the overall goal for Healthcare Home is to reduce healthcare costs and improve healthcare outcomes at the same time. The two are inextricably linked. You can't reduce costs if people are having poor outcomes. They're just going to continue to utilize more and more services, and we can't sustain that forever here in the United States. So these are the federal expectations for this program: lower rates of emergency room use, reduce hospital admissions and readmissions. So going back to the hospital after you're discharged for basically the same reason, because you weren't taken care of correctly the first time. Reducing healthcare costs, decreasing reliance on long-term facilities, improving experience of care, quality of life, and consumer satisfaction, managing health conditions, and improving health outcomes. So to do this, we kind of embody this idea: improving lives through supports and services that foster self-determination. This is the mentality we use to structure Healthcare Home. At Comprehensive, we have about 460 clients who are each assigned to a nurse who kind of acts like the hub. We monitor client healthcare utilization. We provide education and client-driven goal setting. We see them for an annual health screening, and more frequently if a client's engaged. Basically, the nurses that I oversee, I have clients who have their direct extension. So if the client needs something, they have someone that they can always call to say, hey, where should I go for this? They also follow up and reconcile medications, so make sure the medications are appropriate and they don't have duplicates after they get discharged from a hospital or an emergency room. They also have caseworkers who see them on a regular basis based on what the client needs. And most of the clients that we see also see therapists, a psychiatrist, and a primary care provider that we have on site at Comprehensive. So it's kind of a one-stop shop because we have a pharmacy too. So it's a one-stop shop for clients who have a variety of debilitating physical and mental health diagnoses. All right, so a little bit about the clients. These clients are extremely vulnerable. This, for example, is a MGAF score. It's basically just a score of how you can function on a day-to-day basis. Most of us are going to be between 81 and 90. We're independent. We can make good decisions for ourselves. We take care of ourselves by and large. It's most of the people you encounter daily. These clients are typically half that, the 2 really high bars. They have difficulty performing daily responsibilities. They have a hard time critically thinking, making decisions, remembering to do things. Sorry, my notes fell off. Basically, they're not independent at all. In addition to not being able to function very well on a day-to-day basis, they also, I got logged out. Hey, honey, Can you come fix this? Jordan's my husband. Thank you. So these clients also have a lot of health concerns. So the general population is the bar to the left of the orange. I think it probably looks great to you guys. And I want you to take special note to hypertension and diabetes. I mean, this population is in orange, so they have a much, much higher prevalence of these diseases than most of us do. And part of the big reason for that is that they're on antipsychotic medications, and they have nasty side effects like obesity, and diabetes, hypertension, cardiovascular disease in general. And the problem is that these clients absolutely have to take these medications because their functional scores are so low. They can't function on a basis, they need these meds. As a direct result of that, the number one killer for clients with a mental health diagnosis is actually cardiovascular disease, which a lot of people don't know. All right. So this delivery model the healthcare home that I've started to go over, has the potential to save the country and Missouri a boatload of money. So the mental health healthcare homes alone in the first year saved the state $31 million. And of that, $22.8 million was by the disease management cohort. Now, these are the 3,700 clients that you could call super utilizers. They utilize the vast majority of healthcare services. They have the lower functional scores. They have more of the comorbid diseases. They're just a lot harder to manage, and we were able to make that big of an impact in just 1 year after implementation. The big way that we did this was reducing hospital and ER visits. So you can see just in the first year, like the data was on an upward trend. It got implemented in 2011, and in just the first year, we reduced the hospital days per 1,000 clients by 38%. I mean, that's a huge chunk. And basically all we do is just provide the clients with a direct line to a nurse. I mean, that's it. Then the nurse acts as a care manager. If the client needs something that the nurse can't provide, they find someone who can. That's their job. It's pretty awesome. They do great work. This is the big mentality that we use to make that huge impact that resulted in those cost savings. So small changes make a big difference when it comes to health. And this is good for all of us to know, because I know that these aren't the only clients with high blood sugar and high cholesterol and blood pressure. If you can reduce cholesterol by 10%, you reduce the risk of cardiovascular disease by the same. If you can make a small reduction in blood pressure, you can reduce your risk of stroke by 42%. And with A1C, which measures how well you manage your diabetes over time, if you don't know that, if you can just reduce it by 1 point, you reduce your risk of diabetes-related deaths by 21%, and the microvascular complications that lead to stroke by 37%. So using this idea, we helped encourage clients to exceed the initial goals. So the initial goals have the green bar there, and I mean, the clients killed it. All these people needed was somebody to listen to, somebody to take an interest in them, somebody to actually help them manage their health care in a way that would help them. And the outcomes have been absolutely fantastic. Now, it might come as a surprise that Missouri was actually the first state to spearhead this. We were first. I usually don't think of Missouri as too groundbreaking, but we actually did it in this case. And our outcomes have been so great and its potential so promising that the National Association of State Chief Administrators selected Missouri Health Homes as their 2015 case study at Harvard. And last October, the American Psychiatric Association awarded us the Psychiatric Services Gold Achievement Award. All right, finally, these are all the states that followed our lead. We've consulted with even more, but these are all the states that have followed our lead and currently have implemented their own versions of the healthcare home program, so they're going to be able to see these results and save the same money for their state too. So in conclusion, I really like my job, especially it can be hard, especially when I have to take off my healthcare home director hat and put on my director of nursing hat. When I do that, I have to deal with the day-to-day problems and lots of things that nobody really knows how to handle. So it's a lot of troubleshooting, it's a lot of using Google and just trying to figure out the best way to approach a problem. But when I'm able to put this hat back on, it's exciting because it's a program that actually makes a difference in people's lives, and it trickles down and makes an impact with our tax dollars too. I feel good about this program because I know that it's a great utilization of our tax dollars. The state's made an effort to try and streamline the healthcare so that it not only saves us money, but our clients are a lot better off. What's also cool about it is that it's new enough that if I do something right that nobody else has done before, it can be implemented across the state and maybe even across the country. But if I do something wrong, nobody else really knows how to do it either. So I just have to reach out to everybody else, and somebody will have some kind of an idea, some kind of a direction to go in. It's creative and it's challenging and it's technical, and it blends my healthcare experience with my property management experience, oddly enough, and my constant need to have problems to solve. So I'm very lucky to have this, the healthcare home, as a career. Thank you.